I have the most effective way to significantly reduce gun-related deaths in America is through stricter gun control laws combined with stronger psychological evaluations and mental health screenings. Gun violence and mass shootings put students, teachers, and communities in constant danger. Many people fear going to school or public places because shootings have been more common in America. This fear can cause anxiety, trauma, and make it harder for students to focus on learning. Allowing teachers to carry guns could increase the chances of accidents or weapons being misused during stressful situations. Teachers already have the responsibility of educating students and should not also be expected to act as armed security guards. Even when training, teachers can still struggle with mental or stress issues that may affect decision making. Current gun laws and school safety policies are not enough to fully prevent school shootings. For example, Texas does not have strict laws with guns, and anyone can get a gun more easily compared to other states, and more deadly school shootings were in Texas. Schools lack proper security measures or trained officers on campus every day. Because of these weaknesses, students and staff continue to face safety risks. Stricter gun controls and psychological evaluations can keep firearms and dangerous individuals. Metal detectors in schools and public safeties can improve safety as long as they don't interfere with students' daily routines or create a prison-like environment. An additional step for security is having a trained police officer present each day to respond quickly to threats and help prevent violence and stop an incident before it occurs. My second claim is the United States government should provide free healthcare to low-income citizens while making healthcare more affordable for middle-class families, in order to improve access to medical care without creating excessive economic burdens on taxpayers. Many Americans cannot afford doctor visits, medications, or emergency care because of healthcare costs are extremely high. Low-income families often avoid getting medical help because they fear of medical debt or losing money needed for basic living expenses. As a result, preventable illnesses can become more serious and dangerous over time. Completely free healthcare for every citizen could place a major financial burden on the government and taxpayers. Higher taxes and government spending may lead to economic problems or reduce funding for other important programs like education and healthcare systems. In some countries with government-run healthcare systems, patients also experience longer wait times for appointments and surgeries. The current U.S. healthcare system is expensive and difficult for many people to access, especially those with low income. Insurance companies and medical costs continue to rise, leaving millions of Americans struggling to pay for care. Although programs like Medi-Cal exist, many people still fall into gaps where they earn too much money to qualify for assistance but not enough to comfortably afford healthcare. The government should create a system where healthcare is free for low-income families and more affordable for working and middle-class families. Basic medical needs such as doctor visits, emergency care, and necessary treatment should be prioritized over optional procedures like cosmetic surgeries. This approach could help reduce health disparities, improve public health, and still allow private healthcare companies and medical innovation to continue growing. My third claim is the government should establish safe consumption sites as part of reduction strategy to reduce overdose deaths, improve public safety, and provide individuals struggling with addiction access to healthcare and rehab services. Drug overdoses continue to take thousands of lives each year, especially with those rise of dangerous substances such as fentanyl. Many individuals use drugs in unsafe environments without access to medical assistance during emergencies. Without supervised spaces, preventable deaths and serious health complications continue to increase. Public drug use can create unsafe and unhealthy conditions in communities, including discarded needles and increased emergency medical calls. Addiction also contributes to homelessness, disease transmission, and overcrowded hospitals. When people do not have access to support services, communities experience greater public health and safety challenges. Current approaches that focus mainly on punishment and law enforcement have not fully solved the drug crisis in America. Many individuals struggling with addiction avoid seeking help because they fear arrest or lack access to treatment programs. As a result, overdose deaths and unsafe drug use continue despite existing laws and policies. Safe consumption sites would provide supervised environments where medical professionals can respond to overdose and connect individuals into rehab and mental health services. These facilities can also reduce public drug use, lower the spread of disease, and decrease pressure on emergency healthcare systems. Addiction should be treated as a public health issue, and harm reduction strategies can save lives while encouraging long term recovery.